President Obama has spent almost every day in the past 2 weeks pushing his health care agenda. Our next guest, though, says full coverage for everyone in the country will bankrupt us. So what is the alternative? We're asking the former CEO of Medtronic, Bill George, now a professor of management practice at Harvard Business School. Bill, thanks for joining us. Let me ask, first of all, why it seems that no one in Washington is looking at the fact that the costs of covering everybody in this country will just be way too much to handle.
Yes, I'm very concerned about what happens to Medicare. I admire President Obama for taking this on, but we're looking strictly at a political solution and not a policy solution. We've got to address access, cost, and quality. And so far, we're only addressing access. And I am in favor of people having access. I am in favor of portability when you change employers, no pre-existing conditions. I think those are good things. But the question is, how are we going to pay for this? I don't think you can just pay for it by, once again, cutting Medicare reimbursements that will then shift the costs over to private employers and taxing everyone for it. I think we have to look at the basic cost problem. The cost problem is one of lifestyles. We need to focus on prevention and wellness. We need to focus on quality inside our hospitals, the quality of care. No one's doing that. And until we look at all three aspects of this problem, you're going to have a huge cost with no way to pay for it. Now, back to the access. I actually favor all citizens having access to health care, because right now they go to the emergency room at the worst possible time if they don't have coverage. What I would favor, something my colleague Michael Boskin recommended in the Wall Street Journal yesterday, which is a high deductible, low premium, catastrophic plan. Not for primary care, but much more for people when they have severe problems, and they could buy into such a plan to be managed by an independent board. Loading everything on Medicare, I think, is a big mistake, particularly if you don't know how to fund it. And that's what's really worrying me right now.
Bill, you mentioned that catastrophic insurance plan. Would that be a supplemental plan or a primary plan as well, or mandatory plan?
I think it would be a primary plan that all Americans could have, particularly those that don't have full coverage and perhaps can't afford full coverage. That's the idea of the low premium, high deductible kind of plan. But I think that's what I worry about. People have to have a heart transplant, or they have very severe problems. They have cancer. We don't want them to not have coverage, and so they go to the emergency rooms, and they're covered by the hospitals, but it's not good care. And so I think, but we have to combine that with a real focus right from the president on prevention and wellness. And I don't hear that among the politicians. No one's talking about how are we going to get healthy, because we know that a high percentage of health care costs come from unhealthy lifestyles.
Let me ask you, this came up early in the push for health care, but it hasn't really been addressed since. A viewer writes in and he says, on health care, if the nation is truly interested in a comprehensive reform of the health care system with a specific focus on the cost of medical service, then why isn't protection from simple negligence on the table? I mean, don't doctors have to pay an outlandish amount for insurance against malpractice? And if we got that off the table, wouldn't that cut costs sincerely?
Yes, and I was disappointed even President Bush didn't take this on. I think we have to have tort reform. No question about it. But I think also people have to have an economic stake in their health. So we should reward people for healthy lifestyles. Why don't we do that? If you have a healthy lifestyle, if you have a solid body mass index, you don't smoke, you have, I think people that don't spend a lot of money in the healthcare system should have lower premium. We don't do that today, and I think we need to do that because, like in every other aspect of American life, they have to be in incentives, and in this case, incentives for taking care of your health.
Bill, I talked with Jeffrey Kong, the doctor and chief medical officer from Cigna, the other day. He said that Cigna is rewarding people for healthier lifestyles and that the push for this needs to come from the private sector. Obviously, you don't want the government telling you what you can and can't do.
Well, I agree. Medtronic, we did that, and it worked marvelous. I mean, we have about half the health care rate of a lot of other people in the country because there's such a focus on prevention and wellness. I think so, and there were definitely rewards there are today, definitely rewards for doing it. I think we have to do that. But if the Medicare plan just reimburses people and cuts doctors' reimbursements, actually a lot of primary care doctors are not well compensated today. That'll just shift the cost to the private sector, and it's going to make the problem worse. We're not solving the fundamental tenets of the problem.
All right. Hey, Bill, thanks so much for joining us. Our thanks to Bill George there of the Harvard Business School. Now,